Thank you for joining us on Journey to 600. Today we're going to be going over cardiopulmonary interventions. So first we're going to be going over ventilation techniques. There's 6 different kinds that I feel like I remember from studying for my boards, and I've put them all right here. So first there's segmental breathing. So this is when you treat a specific lung segment. There's sustained maximal inspiration. This is used for a collapsed lung or relieve pain. This is when you see people use those incentive spirometers. Then we have active cycle breathing technique. So you commonly see this as ACBT. This is for breathing control and can be used to clear phlegm if huffing is involved. I provided an example here, but I'm also going to link a YouTube video below. Make sure you check that out. I feel like it's easier to understand when you see it visually done. Then we have pursed lip breathing, which is used for people with exhalation problems and or obstructive disease. Next, we have diaphragmatic breathing. This is for people who have inhalation problems and or restrictive diseases. Then we have paced breathing. This is used for abnormal respiration rhythm or dyspnea. Next, we have autosplinting. So this is when somebody is having pain from respiratory movement, but is relieved by lying on their right side. And lastly, we have huffing, which I briefly mentioned with the ACBT. So huffing is when the abdominals are pulled up and in rather than pushed out. This is an effective way to clear airways. I'm also going to include another link to a YouTube video on how to do huffing. Okay, the correct answer is B. Your patient is post-thoracic surgery, and you want to educate your patient on a breathing technique to prevent alveolar collapse. What type of breathing technique do you want to use? So A, pursed lip breathing. This is commonly used for patients with exhale issues. In this situation, we're trying to prevent your patient from having that collapse, so we need to work on that inhalation. Then that brings us to B, which is sustained maximal inspiration. That's when we're educating our patients on using that incentive spirometer because it helps keep that inflation in those alveoli. Then C is active cycle breathing technique, which we know is for breathing control and helping clear phlegm. Then we have D, segmental breathing. This is just working on a segment of the lung. It's not helping the overall inflation of your alveoli. Okay, our correct answers are false. So, for auto splinting, you don't lay on your left side, you lay on your right side. Then, when completing the huffing technique, you don't push your abdominals out. Instead, you pull your abdominals up and in. Thank you again for joining us on Journey to 600. Please like, subscribe, and turn on your notifications.